transition now. We would like to welcome someone who is actually, I'm going to let her tell you her story, but I am going to just mention a little bit about her bio. Anikah Salim is actually, she joined her first Miles for Migraine Walk run in 2018, and she has increased her involvement in Miles for Migraine. She's been to the Migraine Patient Education Day. She's been to RetreatMigraine, which is part of the Coalition for Headache and Migraine Patients. She's been to other events. In 2019, she trained with the US Pain Foundation, another fabulous advocacy group that I suggest you look into, US Pain and also CHAMP, the Coalition for Headache and Migraine Patients. She also, in January 2020, Anikah worked with us, and she has been one of the hosts of our Miles for Migraine virtual support group, which you can check out on our website, Migraine Community Groups. We really want to encourage you to come and join those, especially in this time. It's a program that's ongoing thanks to people like Anikah. She continues to share her journey experience in an effort to increase migraine awareness and provide support for everybody who has migraine. And with that, I'm going to unmute you, Anikah. There we go. Oh, wait, I muted you again. Okay, welcome, Anikah. You can tell us the rest of your private story.
Okay, great. Let me go ahead and share my screen. All right, can you all hear me? Can you all see my screen? Okay, I see some head nods, okay.
Yes.
Okay, thanks so much, Shirley, for having me today. And also thank you so much, Dr. Watson, for your presentation. It was very informative. And you also helped me with part of my presentation. So thank you. I'm just happy to be here to just share my story, my testimony, and my journey dealing with migraine. So before I get into my specific migraine story, I just want to tell you a little bit more about me. I do work full-time. I'm a full-time student. I love to travel, love to eat, although my brain and stomach don't always agree with that. I'm very extroverted, and I wanted to tell you about that. I mean, there's so much more to me, but I think that's important because migraine has definitely impacted all of these aspects of my life. And I put this down here because there's many people who deal with an invisible illness, and migraine is an invisible illness. But unless we talk about it, people don't always walk in our shoes. So they wouldn't understand, they wouldn't get it. So I think it's important to always share our stories, which is why I'm here today. So my chronic illness is not new to me. I've had chronic conditions since childhood. Throughout my teens, I dealt with knee dislocations. Chronic knee dislocations, and in 2008 I had a surgery that corrected that, and I have not had a problem since. And I was like, yes, okay, moving on, and this is great. But then as I was recovering, my surgery was a 5-year recovery, and as I was recovering, I ended up having back pain, chronic back pain, and it was so severe I could barely walk at times, and I had a herniated protruding disc that was pressing on my nerve. So in 2014 I had lumbar epidural, and that I was excited about that. I was looking forward to it, getting relief. However, I would say maybe a month before, my procedure was scheduled October of 2014. September of 2014, I got a headache that did not stop, would not go away. And I ended up going ahead and having my procedure in October, but that migraine persisted. It was intractable for 10 months. And it wasn't until late 2015 that we figured out what was wrong, and I was actually diagnosed with chronic migraine with aura. And as I think about what I've been through, I think about the fact that I had so many dreams and aspirations. And actually, I was in my doctoral program, my PhD in epidemiology, when this migraine attack started in 2014. And it impacted school. I had to take time off of school. And so I thought about everything that I dreamed for myself, and I realized the future was not what I envisioned. And everything I was excited for seemed to end it before it really got started. But the more I became involved in the community and understanding what I was experiencing, because I did have to educate myself on migraine. You know, when migraine first came up, I said, how can a headache cause me to go blind? How can a headache cause me to lose sensation in my body? How can a headache? I didn't understand, all of these things that were happening. And from what I understood to be a headache, that I had them for my whole life pretty much, and I could take something, it would go away. So I had to educate myself on my own condition and understanding what I was going through. And the more I did that, I didn't see my life as being something that had ended, but something that was actually starting. And I think it was something that was beautiful, meaningful, and had a purpose. And I always felt like no matter what I did in life, I wanted to have a purpose. So I began to develop new dreams and new aspirations. And after that, the hope of my future and what I was going to be experiencing actually became a little bit brighter. So as I share my experience with chronic illness, I always thought like everything, I was getting better. This is done, moving up. But the reality is it's not linear at all. And I just have to keep pushing. And I think it's important to keep pushing because there is a point where it will get better, but it's not always a straight line. So as I educated myself, I had to realize that I blamed myself a lot. I thought, the first thing was, what did I do wrong? What am I doing? Why am I having these attacks that are so severe and so debilitating? But as Dr. Watson mentioned earlier, this condition affects so many people around the world, 1 billion people around the world. And as he mentioned, it's the 3rd most prevalent illness and the 6th most debilitating illness worldwide. So when I think about that, I realize, wow, there's so many people going through what I'm going through, and it's not just something that I can treat easily, but I have to realize that this is something that's actually happening in my brain. And I wanted to add on to that, of those 1 billion people that are affected with migraine, 4 million of them have chronic daily migraine, and at least 25% have the auras. And so I'm in that small percentage, having the chronic migraine with aura. It's a very small percentage. And that is what made me realize, wow, this is something that we need to talk more about. It's not known, it's not fully understood, and there's not many doctors that practice in headache diseases. So all that to say, I realized like it's not my fault, it's not your fault. And a lot of times we might get reactions from our family or friends or people who may not understand, coworkers, supervisors, and it's hard to describe. I can't just necessarily take something and it goes away that easily, as Dr. Watson just mentioned, the duration of migraine. So with that, I decided that I needed to connect with people who understood what I was going through. And it wasn't until later on, about 2016, 17, where I got onto social media and my mind was blown. I was like, wait, all of these organizations that deal with headache and migraine, all of these people, this support system was there. And it's very important to have a support system, period, in life, but especially if you have a chronic condition. And I love this picture by Ava. Ava has a rare condition, and her sign there says, "I'm smiling because of the community we have on social media." And when you're faced with a chronic condition as it makes its way into your life, there's a strength that comes with that, and a strength that at least I didn't know was there. You may not know is there, but at the same time, it can make you feel weak, you can feel frustrated, and you can feel very isolated. So I put this here, let us grow through what we grow through, because no matter what you're facing, no matter what you're fighting, and no matter how lost you feel, you are not alone and you have support. And the more I kept becoming involved, the more I decided, I'm going to outshine my label. I don't want to be labeled with chronic illness. I don't want to be labeled as the person with migraine, even though migraine is part of my life, but it is not my life. And so this, I said here, we must be willing to let go of the life we planned so that we can have the life that's waiting for us. And so like I said earlier, I created new dreams, and I decided to hashtag migraine doesn't win, which is also my Instagram name, migraine doesn't win, because it's not going to win over my life, and it doesn't have to win over your life. And not definitely understanding how debilitating it is, but there's always something better. And with outshining my label, I realized like migraine advocacy is extremely important. We mentioned the statistics of migraine disease and migraine and headache. And worldwide, there's a minority of people with headache disorders that are actually diagnosed properly by a healthcare provider. And I remember as a child going to the hospital, going to the emergency room, having extreme pain, and everything I did was just take something over the counter. But not having that diagnosis is very important. And that's why advocacy is extremely important for us to continue to spread awareness about migraine and headache disease. And also headaches and migraine disease are both underestimated, they're under-recognized, and they're undertreated. And we're just getting these new treatments out on the market, and that's due to the advocacy that's been going on. Advocacy is very important in beating stigma. You can connect, for me, I've connected with a number of organizations, as Shirley mentioned, Miles for Migraine, US Pain Foundation, the Coalition for Headache and Migraine Patients, or CHAMP. But it's also something you can advocate for yourself with your family and friends to continue to bring that awareness about this condition. And I like this quote by Vice Admiral Adams, who's the US Surgeon General. He says, better health through better partnerships. And for me, the partnership is not just with institutions or hospitals, but it's with those in your own circle. And that partnership is what's going to help improve your own health. And it certainly has done that for me. I've been involved with many organizations now, and not just within the migraine community, but outside, and sharing my own story. And when I actually posted this picture here that says, I am one of the billion, when I posted that, I cannot count the number of people that privately messaged me that I knew personally that said, I'm one of the billion too. Family members that I didn't even know were suffering with migraine and were truly suffering, and they were one of the billion. And so the more I spoke about it, the more I began to see the people around me who were suffering in silence. And not just with migraine, but other chronic conditions, suffering in silence. And now they're sharing their story. And, you know, these faces, these pictures of me smiling, I believe I had migraine in every single one of those pictures. So, you know, you can see it, you can see smiles, and you can see what's on the exterior, but inside, you know, we're dealing with something invisible. And there's a lot of people out there who are still dealing with an invisible condition, and your voice can give encouragement to them. And I'm very glad that more people are able to speak out. I even had, you know, people will reach out and say, I know someone with migraine, what can I say, what can I do? And so even the more, you know, we're sharing, the more we're able to impact each other's lives. The other thing I wanted to share about advocacy is not just within your own community, but it also involves policy. And that's where, you know, when we think about treatments and funding for migraine and headache, this is where we need to make the biggest impact, and petitioning to lawmakers. And these are a few of the organizations that do that. The Alliance for Headache Disorders Advocacy, it's a nonprofit, and they focus on the health of patients with headache disorders, and they advocate for equitable policies. And they do that advocacy through movements such as Headache on the Hill. And that's an annual advocacy event here in the DC area, specifically in Washington, DC. And many health professionals, migraine, headache patients, and advocates, they come together to represent their questions or asks to Congress. which focus on improving awareness and the impact of headache disorders and the need for research and funding. As we just, Dr. Watson mentioned, there's some studies that we don't, we still need patients for. There's some FDA push for more drugs to come on the market, but we need the research and we need the funding for that. So advocacy is extremely important in that area. I wanted to share, this is a lot to read. If you have time to read it, if you're able to read it while I'm talking, I just wanted to share this. This is policy in action. So this is, this email was sent in my specific office where I work, and they put a policy out stating that we can't use fragrances, and they talked about the number of patients. I have it underlined there with conditions and that are triggered by fragrances. And I wanted to share this because when you think about, I work in the government, government agencies have been around for decades, and now we're starting to institute these types of policies. And so your advocacy can affect change, major change. And you think about I think about all the people before me, many years who've worked and retired, but the more we push, we can see this come to fruition. And it may not happen in your own lifetime, but it's important because it can affect the future generations. And so I shared my migraine story with you, but now I wanted to share it as a patient advocate, because I'm not just someone who suffers from chronic migraine with aura. I'm not someone who feels debilitated all the time, but I am sharing my story because other stories have encouraged me. People talking about what they go through have encouraged me, and that really is my goal. And also thinking about, people who may have headache and may not know that it could be something more, or children. I see children. I have a young person in my support group, and she was recently diagnosed, and so there's young people who are experiencing this condition, and may not know that they have a misdiagnosis. So I've shared my story in the special edition of the Invisible Project. And Invisible Project highlights many invisible illnesses, not just migraine. And as Shirley mentioned, I've worked with US Pain Foundation and have the online migraine community support group weekly. But I put this picture here in the middle because I still have fun. I still enjoy life, and that is extremely important to me. I may have to modify things as far as travel, as far as going out all the time or interacting with people all the time. That is modified and is a challenge sometimes, but again, migraine doesn't win. I enjoy my life. I enjoy getting out there, and I do have quite a bit of fun. And so I've had a new normal, and I shared this poem here because what I found is that although we go through painful things and difficult things, there is a silver lining, but, and we can move on. We can still live through the challenges and the pain that we face. And my pain may be high, but so are my hopes. We all come from different backgrounds. We all may have different beliefs, but for me, I read the Bible, and one of my favorite verses is Romans 8:18. And it says, for I reckon that the suffering of this present time is not worthy to be compared with the glory which will be revealed in us. And so you may experience something challenging now. You may go through something so debilitating, something that is significantly affecting your life, but it doesn't mean that because you're going through that today, that it's going to be like that tomorrow. And I think that's where I put my hope, in that there's something better to come. So I just want to encourage everyone that, it's important to share your story. It's your story, it's your way, it's unique to you, and the world needs to hear it. So don't be ashamed to share it. And as you think about where you were a while ago, look at how far you are. And the important thing is, look, we're all here, which means we've survived 100% of our migraine days. And so think about who you are and where you are instead of what you're not. There may be things you can't do. You can't do everything the same. There's some things you can't do at all, but don't think about what you're not, think about what you are. And you're so much more than your condition. So lastly, I just want to say you are strong. You are stronger than you think. You are not alone. Keep going and don't quit. Oh, one more. So I've learned like through this to make yourself a priority. That is a big deal for me. We cannot pour from an empty cup. You have to take care of yourself. You can't give to someone what you don't have. So make yourself a priority, take care of you, and then you can pour out. And just remember that where you are here and now, it's not the end. You're still here and your story is still being written. Anything is possible. So with that, if you like to find me on Instagram, this is my Instagram name, hashtag migraine doesn't win. And again, I'm just so thankful that I've been able to share my experience and my story with you all. And I hope that it encouraged some of you.
Thanks, Anikah. That was a really very inspiring and informational share that you did. We really appreciate it. We just have a couple questions. The first question is, sounds like you have talked with your employer. What are some words of advice when someone shoots you down and doesn't really understand what you're trying to say? What has helped for you to help people to understand your story?
That is a very good question, and it's a challenging question. I come from the aspect that when I was diagnosed, I didn't understand what I was experiencing. I didn't get it. So I just try to let them know what the condition is, what I experienced, and I offer some videos or resources, I should say, to them. And they don't always take it, they don't always accept it, but I do have my physicians and my doctors who are supportive in providing any information I need when it comes to employment. Also with school, I was really blessed to be able to get a medical waiver as I went through school. So I would say it's not a one-time thing. It took some time, but the more I shared about it, the more they were willing to at least listen. And sometimes they could see it, to be honest. Sometimes they could see the changes going on with my face and what I was experiencing. I also, I will put out there that I work in a government agency, and I know that's very different. There's ethics, there's HR, and there's many organizations, private industries that do not function the same, and I recognize it could be much harder to address this issue. But what I will say is, if you can get your doctors to support and to specify your needs and what challenges you might have, that is the start. And also just sharing little things, like if I saw something pop up, I would share it with the people at work, and I would say, hey, this is what I was talking about, and it has data and evidence, and so that's a good start.
Okay, great. Thank you for that. And then the other question is, what is some of your self-care routine?
Sure, I sleep a lot, a lot, I would say. So I had to identify what my triggers were. Again, migraine can attack without even a trigger. Sometimes you have no idea what it is. But the main thing is I try to sleep and wake at the same time. I go to sleep very early. I've had to put my phone on silent, do not disturb. And then the other thing I do is I eat regularly, eat often. This morning I went for a walk, so when I can, I move as much as I can. I walk there. Again, dealing with migraine, it's not easy, and sometimes I'm extremely exhausted, extremely tired. I used to be very, very active, as in I would take on a lot. Like I clean, I cook, I go grocery shopping, whatever the case, hang out with friends, but I've decided to not overwhelm myself with too much to get fatigued and exhausted. And that might sound, honestly, just saying it sounds absurd, but truthfully, I can't do too much at a time. If I wash a load of clothes, I may not be able to put them all away, or, the same day, or wash clothes and cook my meals for the week. So I've had to recognize what my limits are, and that has helped so much. And the same thing with school. Working full-time, going to school full-time was very challenging. If anybody has ever experienced that brain fog and your brain literally shutting down. It's not a good feeling. So I've had to, again, learn my limits and know what I can and can't take. And it's very different. Again, this is your story, your journey. It's very different for you as opposed to someone else. But I talk to other people and find out what works for them. And if it works for me, I'll try it. So the main thing is make yourself a priority, know your limits, don't overdo it. And that has helped. As far as prevention, there's certain things that I try, like ginger, turmeric, things like that. But really recognizing I have to rest and take a break and not overwhelm myself. I hope that answered the question.
Yeah, that's a great answer. Thank you so much. Okay, with that, we are going to pause here for a moment. And I just want to finish up by saying that we have more amazing sessions just like this one coming up. We've got an interactive art therapy and group discussion focusing on sharing your journey. We'll have a panel discussion, medical marijuana and CBD, how can it help you? What is CGRP mechanism of action? We'll have an interactive group discussion on sharing your migraine story with our migraine community group leaders. That will be on June 6th, and or maybe not, maybe that's June 20th. Then we'll have more patient warriors sharing their story. We have more topics that we'll be announcing soon as we continue to firm up our schedule. We hope you'll join us, and we really need you to fill out the questionnaire that will be emailed right when this is over, so we can continue to bring you great programming. And please, please go to our virtual page where you can see our virtual exhibit hall, thanking our sponsor this morning, Amgen. And I thank all of you for coming on. I hope this was helpful. Please come back, and please don't forget to do your own virtual walk, run, or just relax event and be part of our across America. We're going to share stories and make a virtual photo album. So be in it. Thanks, everyone. I hope you have a low pain day, and I hope you'll come back. Bye.